You know how sometimes your online shopping cart or your streaming queue just totally gets you,
Oh, yeah. Creepily accurate sometimes.
right? It knows what you want, maybe even before you do,
Mm.
suggests the next perfect thing. Well, that's data working behind the scenes, influencing our everyday choices.
Mm-hmm.
But imagine taking that same power, that huge amount of information,
Mm-hmm.
and applying it to something as critical as healthcare.
Well, it's not just an idea anymore, is it? It's really happening now.
Exactly. So today, we're doing a deep dive into big data in healthcare.
Okay.
Our mission here is to unpack how these massive amounts of health information are being gathered, how they're analyzed, and then how they're actually used to, drive decisions, shape policy, and ultimately transform the care you might receive.
Right.
Think of this as your fast track to getting really informed about this super complex, always changing field. We've drawn on insights from a whole range of experts, people working in health IT, policy, and looking at how big data is actually used on the ground.
Okay, so let's start unpacking. When we talk about big data in healthcare, we're not just talking about bigger spreadsheets. We mean these incredibly large, really complex data sets. They're honestly beyond what a person could manage or even fully grasp without serious computing power.
Right.
It's about capturing and understanding these whole complicated processes at a scale we just couldn't imagine before.
So it's not just more data, it's fundamentally different, needs different tools.
Totally different challenge.
I've heard about the 5 Vs to describe it. I think understanding those helps show why it's such a big deal, especially in health. Can you break those down?
Yeah, absolutely. NIST, the National Institute of Standards and Technology, uses these, and they really click when you think about healthcare. First is volume.
Okay.
Just the sheer amount of data. Think about a single large hospital system. It can generate more data in, say, a week than maybe a small country did in a whole year, just a decade ago. It's enormous.
Wow. Okay. That puts it in perspective straight away.
Then you've got veracity. This is crucial. It's about the accuracy, the trustworthiness of the data. And in healthcare, imagine one tiny error in the data leading to the wrong drug or a misdiagnosis, but scaled up. Trust is literally life and death here.
Yeah, absolutely.
Third is velocity. That's the speed, right? How fast the data flows in and gets processed. Think real-time patient monitors, wearables, ER admissions feeds.
Constantly updating.
Constantly. Fourth is variety. Data isn't neat. It comes from loads of different sources, different formats. You've got structured data, like in a database, but also tons of unstructured stuff, doctor's notes, images, audio files.
Right, trying to make sense of all that together.
Exactly. And finally, value. What's the actual, economic or social good we can get from analyzing all this data? That's the ultimate goal.
That makes a lot of sense, especially the variety and veracity points in healthcare. And it's different from what you might call small data, isn't it?
Yeah, good point. Small data might be like tracking one patient's vital signs over a shift. You can look at that individually, understand it.
Right.
Big data doesn't replace that. It complements it. It gives you the huge population level view, the bigger patterns.
So this is where it gets really interesting for healthcare. Why does this big data actually matter so much for patients, for policy? What's the real payoff here?
Oh, it's potentially transformative. Big data can help us pinpoint what works well in healthcare, what's wasteful and should be cut. It can improve services, the patient experience. For hospitals and health systems, it's a powerful way to, benchmark their performance, see how they stack up. It helps improve patient outcomes, measure if new ideas are working, and find ways to save significant money.
Right.
The big vision is really compelling. Better quality care, lower costs, healthier communities overall, and people more engaged in their own health.
So it's moving beyond just treating sickness to actually promoting wellness and efficiency system-wide. Yeah.
Precisely. It's key for things like precision medicine, tailoring treatments based on your genetics, your lifestyle.
Yeah.
It helps boost disease prevention, health promotion efforts. And on a more practical note, it's a massive help in detecting and preventing fraud, which frees up huge resources for actual patient care.
That's a great overview of the what and why. But okay, to have big data, you need to get it from somewhere. Where does all this stuff actually come from?
The sources are, well, they're all over the place. You've got the traditional stuff that's been building for a while, and then newer real-time streams. Let's start with the familiar one, electronic health records, EHRs.
Right.
These are, hands down, one of the primary sources of big data in healthcare now.
Makes sense. Every visit, every script, every test, it's all logged in the EHRs, like a
Yeah.
digital diary of your care.
Exactly. And EHRs track key things like patient outcomes, how long people stay in the hospital, costs,
Hmm.
all aggregated for research and analysis. They have features like decision support for doctors, reminders. Plus, the big push for meaningful use certified EHRs meant moving data into electronic formats using standard codes like SUMED. That standardization is absolutely vital for comparing data across systems.
Okay, so EHRs are foundational. What about bigger collections of data, like aggregated databases?
Right. Databases pull info from many places. A really common one people might know is the HCHHPS survey.
Oh, yeah, the hospital survey after you leave.
That's the one. Hospital Consumer Assessment of Healthcare Providers and Systems. It collects patient views on their care, creates national benchmarks, and crucially, it actually influences how much Medicare pays hospitals.
Oh, so my feedback on the survey can literally hit their bottom line. That's quite an incentive loop.
It absolutely is. Then you have more specialized databases, disease registries, for instance.
Right.
They track care and outcomes for specific conditions, cancer, heart disease, COVID-19 more recently. They help coordinate care, spot at-risk groups. There's HCUP, the Healthcare Cost and Utilization Project that tracks hospital stays, ER visits, surgeries, and PSORNet. That's the National Patient-Centered Clinical Research Network. It pools clinical data from lots of settings, all standardized, for research comparing different treatments.
So those are the more, let's say, established data sources. But where does it get really interesting? What about the newer, maybe more surprising, real-world data streams?
Yeah, this is where the picture gets much wider. Think about internet searches, social media.
Really? How?
Well, researchers can mine this data for insights, even early warnings of disease outbreaks. Twitter, for example, has advantages. It's real-time, global, huge volume, searchable.
So like a sudden spike in people searching flu symptoms could signal an outbreak before official reports come in.
Potentially, yes. Or tracking discussions about vaccine side effects, for instance. We also have mobile apps and body sensors.
Fitness trackers and things.
Exactly. There are hundreds of thousands of health-related apps and sensors out there now, spitting out real-time data streams. Combine that with other health data, and you might get early warnings for emergencies, drug reactions, flare-ups of chronic conditions, sometimes before the person even feels it strongly.
Wow, wearables actually feeding into public health surveillance. What else is out there that's a bit different?
There's crowdsourcing and citizen science. That's where you pose tasks or questions to lots of people, often geographically spread out.
Uh-huh.
It can give unique insights into patient experiences, maybe help analyze complex data. Accuracy can be a question, but it offers a different angle. And then there's this really important concept: real-world data, RWD, and real-world evidence, RWE.
Okay, what's the distinction there?
So RWD is the raw data collected from sources outside traditional clinical trials, EHRs, registries, wearables, claims data. RWE is the clinical evidence derived from analyzing that RWD.
And RW is getting more important, isn't it? Feels like a shift away from relying solely on those super controlled trials.
It really is. The 21st Century Cures Act, which was huge, specifically told the Department of Health and Human Services to look at using RWE for FDA drug approvals. It's seen as complementing trial data, giving a broader picture of how things work in the messy real world.
Okay, so we've got the what, the why, and the where of the data.
Yeah.
Let's shift gears to policy. Because none of this just happens in a vacuum, right? There's a whole legal and policy framework being built.
Yeah.
How does legislation shape how all this data gets used?
Right, and it's this interesting two-way street, a kind of paradox. Policy sets the rules for big data, but big data findings also feed back and inform new policy. It's constantly evolving.
So when governments are trying to create these policies, what are the big questions they grapple with? It must be a massive balancing act.
Oh, absolutely. They're asking things like, okay, which bits of big data are actually relevant here for healthcare? What's the goal of this policy or data use? Is it better patient outcomes, saving money, reforming payments? What are the roadblocks? Privacy is a huge one, obviously, but also things like companies may be blocking data sharing for competitive reasons, tech issues, even just doctors getting tired of endless data entry user fatigue.
Yeah, practical stuff.
And then how do you encourage sharing? Do you build a strong case for why it's valuable, offer financial incentives? It's complex.
Those are definitely fundamental questions, and clearly a lot of legislation has tackled this over the years. Could you walk us through some key U.S. laws and initiatives? Maybe not every single detail, but the general direction they push things?
Sure, there's a definite progression. The early stuff was really about getting the digital foundation in place. IPA, the Health Insurance Portability and Accountability Act from '96, was massive.
Privacy, why?
Right. It limited data availability in some ways, but also mandated electronic standards for things like insurance claims, and crucially, set those first big rules for protecting health information. Then, jump forward a bit, the American Recovery and Reinvestment Act of 2009, and especially the HI-Tech Act within it, poured billions into incentives for adopting EHRs.
So that's what really drove EHR uptake.
Absolutely. That's when EHR use exploded across the U.S. Those acts were about getting healthcare digitized.
Okay, so phase one,
Yeah.
digitize and set basic privacy rules.
Yeah.
What happened next? What was the focus after that initial push?
Then it shifted more towards using that digital data, connecting systems, and driving value. The Affordable Care Act, ACA, in 2010 brought in incentives for providers to report on performance, for public reporting of quality and cost data, pushing hospitals to collect and share more. That was about transparency and accountability. The EPRA Act, Medicare Access, and CHIP Reauthorization Act of 2015 started shifting Medicare payments towards value-based care, which absolutely requires tons of data to measure performance.
Right, you need data to prove value.
Exactly. And then the 21st Century Cures Act in 2016 was another landmark. It directly tackled interoperability, mandating technical criteria for EHRs to make sharing data easier. It really aimed to smooth the flow of information.
It sounds like a pretty steady push towards more data, more sharing, and linking it to quality and cost while still navigating privacy.
That's a good summary. And alongside these big acts, you had other things. President Obama's executive order in 2013 making government data open and machine-readable added to the available pool. The Precision Medicine Initiative in 2015 was launched specifically to use data on individual differences, genes, environment, lifestyle to improve treatments. That inherently needs massive data sets.
That really paints a picture of a deliberate, long-term effort to build this data-driven system.
It does, and our sources also mention these sort of conceptual building blocks needed things like standardized medical languages, ways to capture electronic evidence, standards for data exchange, good processes, and importantly, people with the right informatics skill.
Right, the human element.
Yeah, North Carolina's statewide data strategy from 2020 is a good example of putting it all together, government, private sector, payers, providers, all collaborating on a long-term plan using data.
That really shows you need that kind of coordinated effort. But okay, nothing this big and complex is easy. What are the major hurdles, the challenges still facing big data in healthcare? What's slowing things down?
Yeah, it's definitely not all smooth sailing. Healthcare has generally lagged behind, say, finance or retail in using data effectively.
Why is that?
Several reasons. Sometimes it's a culture resistant to change among clinicians. Often it's resource limits. Healthcare margins can be tight. It's hard to quantify the ROI sometimes. Historically, maybe not enough investment in the right tech, and the infrastructure needed is seriously expensive.
That makes sense. It's a unique environment with high stakes. So what are the key issues right now that need tackling to really unlock the potential?
Number one, almost always, is data quality.
Garbage in, garbage out.
Exactly. You said it earlier. The data has to be accurate, complete, consistent, clear, precise, useful. Poor quality, missing fields, typos, errors, it messes up decision-making, it costs more to fix later. You can use tools to try and clean data, scrub it, but really getting it right at the point of entry is the best way.
Makes sense. What else?
A huge societal issue is the digital divide. Not everyone is online equally. Minority groups, lower income people, the elderly often have less access, lower digital literacy.
Right.
So the data we collect might not fully represent everyone, leading to biased insights or health disparities getting worse.
That's a massive equity concern, not just technical. What about the tech side?
Well, there's a challenge of data types and formats. Handling both structured data, neat rows and columns, and unstructured data-free text notes, images, and making them work together is really tough.
Yeah, I can imagine.
Which leads to data governance. You need clear rules, standards, controls for how data is managed, kept secure, made available, especially when new data sources are popping up faster than policies can be written.
And the big one you mentioned earlier, getting systems to talk to each other.
Interoperability, yes. It's been called the single biggest barrier for years. The ability to seamlessly exchange data between different vendor systems, different hospitals, across borders, and have it mean the same thing everywhere. Other barriers are things like information blocking, where some vendors might deliberately make it hard to share data to keep customers locked in.
Ah, business reasons.
Yep. And inconsistent privacy laws between states or even federally can make sharing a legal headache.
So even when the tech might allow it, business or legal hurdles get in the way.
Exactly. Plus, real ethical worries about collecting data, especially from vulnerable groups, or the risk of misuse, discrimination, or just plain wrong research findings if it's not handled super carefully.
Right.
And finally, we just don't have enough people with the right expertise. Data scientists, informaticists, people who can take this ocean of data and turn it into useful knowledge. And also making sure the data you have actually fits the question you're trying to answer.
And with AI becoming more common, what are the considerations there?
That adds another layer. Nurses, doctors, everyone needs to think about how these AI models are built. Are they biased? How do we check them over time? We need transparency in how they work. It's a fast-moving target.
Okay, so lots of challenges. Given all that, who's actually doing the work? Who are the key people making big data happen in healthcare, turning potential into reality?
This is where the people really matter. It takes special skills. Professionals like nurse informaticists, health services, researchers, data scientists, they're the ones collecting, analyzing, and figuring out how to apply the insights from big data.
And nurses seem particularly central to this, right? You hear them called knowledge workers.
They really are. Nurses are in a unique spot. They work with EHRs, claims data, public health data every single day. And they combine that with a deep, practical understanding of how healthcare actually functions on the ground. Their role starts right at data entry. They have a legal and ethical duty to make sure that data is high quality. Good data in means usable data out.
So it's not just the analysts later on, it's the quality at the source.
Absolutely fundamental. Nurses can also give crucial feedback on designing these electronic systems, on data standards to make sure useful information gets collected properly. Think about getting detailed family histories for precision medicine that needs to be captured well.
Right.
They're key for bridging the gap between research findings and actual practice, and feeding back insights from the bedside to policymakers who might not see the day-to-day realities of health IT laws.
Is there a good real-world example of a nurse using data to make a difference? Sometimes a story makes it click.
Yeah, there's a great example, Elizabeth Fields. She's a nurse, an expert on tobacco control. She didn't just treat patients, she used data from successful tobacco control programs. And with that data, she secured over $4 million in funding for more programs.
Wow.
And her work also influenced nursing school curricula across dozens of states to include tobacco cessation training. That's a perfect example of nursing expertise plus data analysis directly shaping health policy on a big scale.
That's fantastic. From patient insights to millions in funding and policy change. So what specific data science skills are becoming more important for nurses now, whether they're bedside or in leadership?
Well, at a basic level, nurses need to recognize big data, understand its sources in EHRs, see why it matters for patient care, and use it in their clinical decisions. Plus, just communicating effectively about data with the team.
And for those wanting to specialize or lead.
Then you get into more advanced skills, collaborating on research, using big data sets, getting comfortable with analytic tools, checking data quality, merging different data types. And nurses at all levels, especially advanced practice nurses, really have a role in shaping policy around big data and using findings to argue for resources, like showing how nurse staffing levels impact patient outcomes.
Makes sense. And looking ahead, with AI growing, how does that change the human role?
Well, the prediction is AI might take over a chunk of routine tasks, both clinical and non-clinical.
Freeing people up.
Potentially, yes. Freeing up humans for the more complex analysis, the empathy, the critical thinking, ethical oversight. Healthcare organizations really need to figure out how data from smart devices plus AI can improve the patient journey, make responses faster. The human role shifts, maybe becomes more high level.
Okay, that gives a really clear view of where we are and the crucial human effort involved. So pulling it all together, what's the ultimate vision? Where is all this headed? What are we trying to build with big data in healthcare?
The big picture goal is often called a learning healthcare system.
Okay.
It's this ideal state where the individual patient is truly at the center, where providers can easily and securely access all sorts of relevant health info, not just the EHR, but maybe data from your wearable genetic info, social factors.
A holistic view.
Exactly. A system where you don't have diagnostic tests needlessly repeated because the information isn't shared, and where public health agencies and researchers can quickly learn from real-world data to develop and roll out the best treatments faster.
That sounds incredibly efficient and patient-focused. What national priorities are driving us towards that vision?
There are several key themes in policy right now. One is healthcare delivery system reform, that whole push towards value-based payments we talked about. That requires unlocking data and better care coordination.
Hmm.
The Precision Medicine Initiative is another, making personalized health info available and easily transferable for patients, doctors, researchers. The Cancer Moonshot uses tech to speed up research by pooling massive amounts of genomic and treatment data, even using cloud platforms for collaboration.
So breaking down silos using data seems key.
Absolutely. Then you have things like prescription drug monitoring programs,
Hmm.
state databases tracking controlled drugs to fight the opioid crisis. That's direct data use for a public health crisis.
Right.
Improving public health overall, modernizing how we detect, track, and manage infectious diseases, and fostering research and innovation to create that true learning system where research informs care and care constantly informs research, a virtuous cycle.
And making sure everyone benefits, not just the tech savvy.
Yes, a crucial piece is improving health IT disparities. Actively working to close the digital divide, boost digital literacy so everyone has a long-term digital view of their health and can participate. That seamless, secure flow of information for everyone is foundational.
Wow. We have covered a tremendous amount today, from, just defining big data and where it comes from, through the maze of policy, the challenges, and the vital human role. This deep dive really underscores how profoundly big data is reshaping healthcare,
Yeah.
influencing policy, enabling personalized care, improving public health. It's huge.
It really is a fundamental shift, and it's still very much unfolding.
So as we wrap up, here's something to think about. Beyond the tech, beyond the laws, for big data to truly deliver on its promise, maybe our culture needs to shift too. We need to find ways to incentivize individuals to securely access, use, and even share their own health information for the greater good while protecting privacy. So consider, what's your role in this? As an individual, as a professional, how can you advocate for or participate in creating that seamless, secure, valuable flow of health data? Definitely something to chew on regarding your own healthcare or your work.